Good morning. Good morning, everybody. Good morning, my alumni. And good morning, Chairperson. I'm extremely thankful to my college, CNMC. Extremely thankful to Dr. C.L. Kaushik Seal for organizing this year's reunion. And extremely grateful to him for inviting me for a talk. Now we know that erectile dysfunction is a very much growing problem in India and especially amongst the youth.
Second slide.
And it's taking a wide spectrum of problems because any disease in the body like a heart disease or blood pressure or diabetes or any other thyroid problems, liver problems, any disease can cause erectile dysfunction. So the spectrum of diagnosis and association with other disease comorbidities is very, very high. Now let's focus on just two aspects of this big chapter, that is on young men and middle-aged. Now, according to sexology, young man is defined between any person between the age of 20 to 30 years and middle-aged person as 32 to 53 years. So now we go to the next slide. So that is, first start with the problems in the young people. These days we all have noticed that the young people are very reluctant to marry. They are okay and quite quick in forming a relationship or partnership with the opposite sex. But when it comes to marriage, the commonest answer is that, well, I am not yet prepared to take the responsibility. So what is preventing them from marrying? And also we also find that in young men, they are losing their sexual desire or libido very rapidly. Now this was not the scene even 20 years back. And when 40 years back when I started my own practice, the young people were very eager to marry, and in fact the girls had to save themselves from their proposals and all. But now it's becoming reverse. The boys are not interested in getting married. So loss of sex desire is very common, and let us find out what are the very common reasons of it. The first is, these days the sexual experience is very early and easy because of the pornographic material which the boys at the age of 10, 11 they start watching, and they think that sex is something great, and then they go into relationship to experience sex, and then they find, well, it's not that what we had expected. Second is excess screen time. When the young people are spending more time over their mobile phones or computer screens, that is impacting the brain in some manner which is yet to be discovered in what exact manner, but they are losing desire. So this is the problem basically to the screen time, or we can say this computer age has really caused havoc on the young people. And when they come for treatment, usually brought by their fathers, my son is not interested in getting married, he's getting 30, he doesn't have a relationship, doesn't have a girlfriend, what I do? We find that the boys are having very low testosterone and high prolactin. This is interesting because in the young man you are supposed to expect a high testosterone level, but in today's world the total testosterone is very much close to the bottom line, borderline, below borderline. And what is the most important history that we get from them is that they get no effect of visual stimulation. Now in men, we know that their desire, arousal, everything comes from the visual stimulation. They see and they get excitement. But now it is becoming reverse. They see but no effect. Problems in the middle-aged men we see is complaining of no erection or early loss of erection or very few erections, like once in 2 months, once in a month, that kind of infrequent erections. The reason which is not very difficult to guess is lack of exercise, food habits, too much of carbohydrates and oil, overweight, other diseases as I have mentioned, lack of privacy at home. But they have a normal sex desire and they get stimulated from the visual stimulus. So these are the points, important points to note down before we start our treatment. So the first explanation is obviously you have to start with counseling that, well, you have to find out your screen time, reduce your screen time, go into exercise, go into the sunlight, get some natural vitamin D. Then comes the medicines. We have got 4 categories of medicine here for erectile dysfunction. Fortunately, so less of the other. The first is arginine. That should be combined or alone with sildenafil or tadalafil, and one more compound which is called Terribilis tertiaris is also gaining popularity with good result. Now the important development in this field, the important development field which has come is the treatment through shock wave therapy. Whenever I speak of shock wave therapy, people get into a shock. Oh my God, what is that? But shock wave therapy is nothing new to the medical science. We remember in 1980, there was a shock wave treatment began in the form of lithotripsy, that is breaking down the kidney stones by rays. So during the lithotripsy, it was found in 15 years that people who are have undergone lithotripsy has reported an improvement in their sexual performance. So that led to the point that shock wave definitely helps. And then the further research started that we don't want that quality or that intensity of shock wave as we put it on the kidney stones. So we have got to be very soft and lower. And new shock wave therapy has emerged for last 6-7 years. This shock waves which is given on the penis is very controlled shock waves which creates a very minute injuries into the smooth muscle of the penis. Penis has a lot of smooth muscles. There are smooth muscles in the arteries, there are smooth muscles in the cavernosal. So all these when are pricked, injured, and when body rebuilds them, these smooth muscles became more active, more flexible, and more useful. So once the smooth muscles of the penile arteries becomes better or active, they will allow the arterial dilatation. Similarly, when the smooth muscles of cavernosal responds, they will also expand and accommodate more blood. So we can see that more blood is accumulated. The better the blood accumulation, the better the erections. Last of all, the new treatment is P-shot, which is nothing but a PRP treatment. The PRP treatment was used very much in the wound healing. They were discovered by the orthopedics. Then this PRP was captured by the plastic surgeons and it was given on the facial collagen, facial muscles, which showed good results. Then it was used on the hair, showed good results, and then finally Priyapas was a doctor who used it on the penis, showed good results. In short and brief, what is PRP? So the blood contains RBC and plasma, or RBC, WBC, platelets, and some proteins and some solvents and some gases and some waste material. So what we do is separate the RBC, and what we get is the plasma and the RBC. Plasma consists of about 55% of the blood volume. So once we collect the plasma, we again centrifuge it. That's called hot spinning. So after centrifugation, we find that all the platelets and the stem cells of the body they settle in the bottom of the tube. So all we need is the material on the bottom of the tube and put it back into the cavernous muscles. They have stem cells, they have regenerative cells, and within a couple of days the regeneration begins. So new arteries are formed, new muscles for the cavernosa is formed. Again that results in increased blood supply and increased thickness. So now we have got a lot of treatments which are safe, which doesn't have any side effect, which does not, you don't have to rumble your head or head shake to find out whether your medicines are compatible with other medicines that the patient is taking. Like the patient has got a kidney problem, is taking medicine for that kidney failure, or he may be taking medicine for heart failure, and your medicines and your treatment will not, is very much compatible with other treatments. So these are the new aspects in this erectile dysfunction management field, which is shockwave and PRP, safe and effective. And I thank you, Kaushik Singh and other people, for giving me an opportunity to present this, and I'm thankful for my chairperson to guiding me, and I'm thankful for all the people who took the pain to come here. Thank you so much.
Very nice presentation. Is there any question from the hall? Any question, please? A new topic, it is very much helpful for this condition. And nowadays, it's a real problem for the doctors too, how we can manage these patients.
Absolutely, sir. This is the first time in my 30, 40 years of practice that a pediatrician came and asked what is the treatment for erectile dysfunction. He also said the same thing. He's practicing for 22 years and never had any questions on erectile dysfunction. But these days, his patient, the woman, the wife, are asking for treatment for sex problem because her husband is losing interest in sex and in her.
Yes, it is very much commendable, very much. Thank you.
Thank you, sir. Thank you so much.
I want coffee and tea. Yes,
Dr. Gupta, thank you so much for the extremely an immediate topic and beautiful presentation. I'm an internal medicine doctor practicing abroad. I have a question. First of all, in the general topic that you about lifestyle medicine, do you have any information about plant-based diet in the improvement of erectile dysfunction? Can you explain, sir?
Thank you, ma'am. This is a very nice question, but the answer is pretty big. The first thing, what a person should eat to remain fit. That does not depend on which fruit or which food has got how much carbohydrates or how much vitamins and other substance. That basically depends on his genetic makeup. So before advising for a person for a particular diet, we go for the genetic testing, which is of course done abroad, and we have to send the samples abroad, and then his entire genetic structure comes out. So we now know that this guy is allergic to certain food which he must avoid, and this guy requires certain food that is not taking. Now this, when you do the genetic analysis, they come to know from which place your ancestry is. And the rule of nutrition is, wherever your place of ancestry is, you must take the food what your ancestors took. So whenever he changes a diet, he feels good. Like a person of South India origin lives in Calcutta and develops a taste for rice and fish like his old friends. Soon he gets sick. So whenever he switched back to his South Indian food, he became alright and fit. So the nutrition advice should always be given after doing the genetic testing. There was a guy in South India who was born in South India,